Lack of access to healthcare threatens the lives of ordinary people in conflict zones long after fighting has ceased. From 1989 to 2003, innocent Liberian people suffered under a bitter civil war. These 14 years of unrest left behind a ravaged infrastructure and a healthcare system incapable of responding to the needs of the Liberian population. In their rampages across the country, rebel factions left few buildings untouched. J.J. Dawson Hospital in the town of Harper was not spared.
Everything in the hospital was looted, down to the mattresses, the beds, even the operation tools that the surgeons use.
Most of the hospital buildings were physically damaged, exposed to the elements and in many cases burned.
The delivery table that we have here is not in good condition. We don't have enough instrument, the delivery set. We don't have it. We have to have enough here to sterilize it and be using it as we use it, we put it away.
In addition to the physical destruction of the hospital, the war's toll on the hospital staff was equally dramatic. Most of the qualified health personnel fled the country and settled in less remote areas. Healthcare professionals were not being paid. Fewer and fewer of the trained medical staff stayed in Harper. When Merlin first arrived in Harper, the situation at the hospital was critical. What Merlin did find, however, was a solid physical foundation that, with a longer-term intervention, could be rebuilt and rehabilitated. To make a sustainable impact, Merlin proposed not only to rehabilitate the buildings, but also take on the difficult task of providing training for the staff.
The whole idea with this project is to make it a functional, sustainable system. So Merlin is not here just to provide the money to put in the new pipes, put in water pumps, supply nice, shiny new hospital beds. That is only part of it. The other part, which is probably more important, is to help and advise people as to what they need to be doing to keep the place running nicely, so that when we're gone, they can continue.
Merlin's team drew up a work plan and worked with local people to reconstruct and re-equip the devastated hospital wards. Everything needed to be replaced. The walls were repaired and painted. The ceilings and floors had to be taken out and retiled. And essential hospital supplies like drip stands, mosquito nets and surgical instruments were provided to stock the hospital.
The community in Harper, the people are very happy. Even if you go downtown here, they are praising Merlin. And Merlin is doing well. They are happy that they have a facility here that you can come anytime. Over here, you can come here anytime, any part of the day, every day, whether the holiday, whether the Christmas, this place is open to any patient. They are free to work here. And the hospital is free, they're not paying anything. They come here and get all the good facility. So they are all happy.
J.J. Dawson in Liberia is just one of the hospitals revitalised by Merlin. However, Merlin can only offer such life-saving medical relief thanks to the generosity of key supporters like you.
Togetherness, we can do something. But if we are not together, we can't do anything to carry on any development within the county and within the community. So I think we need to come together as Liberians and put the one thing behind us so that we'll be able to live in peace in our county and in our country, in our community.
Your gift could help ordinary Liberians like Peter build a future for their country in peace. Needles cost pennies. A single drip stand costs just £33. And £100 buys enough mosquito netting to protect a ward of up to 30 patients. So your gift could have a profound and lasting impact.